I have been diagnosed with sleep apnea. Now what? I'm so glad you asked because this is a question that I get to answer all the time. And today we're going to be talking about the top 6 ways for treating obstructive sleep apnea. Yes, 6. So, a lot of times, most people think, well, I have sleep apnea and I'm going to have to wear CPAP and I don't know what else to do. I can't tolerate CPAP. We're going to talk through all of that. Hi there, I'm Dr. Funke Afolabi-Brown. I'm the founder of the Restful Sleep Place and Restful Sleep MD. And so if you have not subscribed to this channel, you want to hit that subscribe button because we're going to be talking about something that is so important. Listen, treating sleep apnea, either in kids or in adults, can be life-changing. It can literally save your life. Today, I'm going to be focusing more on the adult population. I do work with kids a lot, and I have other videos where I have gone into a whole lot of length talking about different treatment options. Now, why is it even so important to treat sleep apnea? I think the first question we should ask briefly is, what is sleep apnea? Sleep apnea is when you have pauses in your breathing during sleep. This is something that's actually pretty dangerous. So you can imagine for some reason or the other, and there are many reasons, it might be anatomical where you have some crowding in your upper airway. It might be excessive fat around the neck or the tongue. But what is going on is that as you sleep, the airway becomes more narrow because things really relax and you're laying down. So that causes an obstruction. And initially, you might have snoring. And after a while, you may actually have pauses. And sometimes it may not be super loud snoring, especially in women. So not everybody sounds like, a train or something, right? So sometimes it may be actually soft snoring. You might present with pausing, gasping, maybe waking up suddenly in the middle of the night and not figuring out and trying to figure out why. You may wake up with a dry mouth. I've seen people have symptoms like teeth grinding. You may wake up with a headache. The bottom line is you have unrefreshing sleep. And like I always tell my patients, think of every time you go to sleep, you're literally suffocating. What's going to happen? It's going to put your body under so much stress. Your brain gets into fight flight mode. And your brain is just like, I'm sorry, you can't go into deep sleep. Every time you try to get into deep sleep, you keep pausing and stopping breathing. And so when you wake up in the morning, you feel like you haven't slept at all. What does that end up causing? It causes a high level of cortisol, again, putting your body under stress. If you have high cortisol, what's going to happen? It's going to lead to a lot of fatigue. It's going to lead to a lot of blood pressure issues. So we see hypertension, we see heart attacks, we see, abnormal heart rhythms. We call them arrhythmias, a higher risk of heart failure. We see things like stroke. Obesity is also something else that I see when sleep apnea is not well treated. So difficulty losing weight and gaining excessive weight. And you're less motivated to lose that weight because you're exhausted. You may start to find out that you're tired all the time and you're not necessarily making the right food choices. So, of course, that might also contribute to conditions like diabetes, impaired glucose tolerance. And then there are also things like Alzheimer's that could come up, not to talk of the mental health piece of it. I have so many patients on multiple medications for anxiety, for depression, and sometimes it's because they have very unrefreshing sleep because they have sleep apnea. Another group of patients that I tend to hear this about is women in menopause. So we know that there's a higher incidence of obstructive sleep apnea in that population. So if you're a woman in menopause, unrefreshing sleep, tired all the time, waking up in the middle of the night, please, please, please do yourself a favor, do me a favor and get evaluated for sleep apnea. How do you check for sleep apnea? You do a test called a sleep study. And nowadays, most times you could get that study from the comfort of your home. At the Restful Sleep Place, this is what we do all the time. We get you in, you get your study sent to your home. After 2 or 3 days, you send the device back. We look at the study and we meet with you and we talk through those options. So you've gone through those steps. You've had the test done, right? You've had the diagnosis made. It sounds very scary, and that's really where I'm coming from to help you understand what your choices are. You may have been told it's only CPAP. It can be. CPAP is a game changer, but there are other treatments as well. So let's start with the treatment options. Yes, for adults, most times, number one treatment option is CPAP. CPAP is also known as continuous positive airway pressure, CPAP. And there are different ways of doing this. Essentially, what it does is think of CPAP as a compressor, that's the device or the machine, right? Literally just pumps air through a tubing to a mask. And so I have a mask here, right? These are the perks of being a sleep doctor. You get these samples, and I was so excited to show you. So this is really where the tubing goes, right? It's connected to this nasal mask. So this mask is what you call a nasal mask, right? And then this is the headgear. So this is what you strap on at night. You put it on. Sorry, I'm not wearing it. I don't want to ruin my makeup. And so you put that on and you connect it to the machine through a hose, right? And so you sleep with this. You sleep with it. You put it on before you go to bed. You sleep with it. And it literally just pumps air to the back of your throat. Remember, I told you that airway is collapsing, stents the airway open so that your brain doesn't have to do all that work of trying to keep you alive, literally, right? This is a game changer. I have heard things like, thank you, CPAP. This device has changed my marriage. It has changed my life. I'm no more irritable. My blood pressure is going down. I'm now motivated to lose weight. I get around much better. I think clearer. Like, these are the kinds of results we get because, oh my goodness, it turns out when your brain gets oxygen, it is happy. An oxygenated brain is a happy brain. So that's the first treatment option. That's CPAP. Now, the thing that is the big piece where people struggle with using CPAP is with tolerating it, meaning that now you got to sleep with a device like this and air being shoved to the back of your throat. Yeah, it is uncomfortable. So you're going to have to work on mindset. And that's a lot of what we work on at the Restful Sleep Place. We're going to work on what we call desensitization, meaning that we're getting you used to wearing this, used to going to bed at night wearing this. We teach you breathing techniques so you know exactly how to sort of pace yourself so you don't feel like you're breathing against a forced pressure, right? And then we work very closely with you because not everybody has one set pressure. Usually we'll start you on maybe a range of pressures. So that CPAP, there are many different devices. There's what we call the continuous positive pressure, meaning you get one pressure. There's what we call the auto CPAP, meaning that it is auto adjusting. So I may start you on a range of pressures, maybe 5 to 15. And then over time, we tailor that pressure and narrow it because we're able to look at your analytics and things like that to narrow it to give you the pressure that you need. And then there's also what we call bi-level positive airway pressure. So sometimes if you have very complex sleep apnea or super high sleep apnea and it's not, and the CPAP isn't working, we might change you to what we call a BiPAP or bi-level positive airway pressure. And then there are many other modes and things like that, but those are the basics. So now what are the benefits? You start to see results almost right away as long as you can tolerate it and you kind of walk through a protocol, so to speak, of getting used to it. You start to feel better, more energy, you breathe better, you function better. Of course, the issue is it is not very comfortable, right? You know, it's not the most sexy thing, right? But I like I told one of my patients recently, yes, I hear you. Wearing CPAP is not sexy, but guess what happens when you're rested? You feel sexy. And so let's look at that. Let's call that a win and really let's change our mindset. I mean, the downsides of it is, you know, if you want to travel, you got to make sure you take it with you, all that good stuff. But usually these devices come in travel packages. You don't need to check it in. It's not considered to be your hand luggage. So in addition to your hand luggage, you could take it with you. I have people who say, I cannot live without it. Not because they're dependent on it, but because they now know what good restful sleep feels like. They're like, I don't want anything else, right? So that's number one, CPAP, stenting your airway open. You tend to work very closely with your sleep specialist to figure out what you need to be on. We walk through some masks. Sometimes the mask fit is the issue. So we kind of navigate all of that until you get the best experience. The second way for treating sleep apnea is what we call the oral appliance. Okay, what's an oral appliance? It is not your night guard. Please, please, please. It's not the night guard you're getting over the counter at the pharmacy. These are custom made, fabricated devices. It does look like a sort of like a mouth guard that you wear every night to sleep. And so what will happen is you would either be seen by a dentist, and so they take some images and do some molds of your teeth, your dentition, your entire airway to fabricate this device, right? It's literally, you can think of it like a retainer. And so then they make those custom made device for you. It is sent to your home or you pick it up and then you wear it, and then over time what it does is it moves your jaw forward. Remember, I told you the mechanism for sleep apnea, your airway is collapsing. So having this technology that moves your jaw forward so that you could breathe at night. Some people who have what we call TMJ pain, so temporal mandibular joint, so that joint pain, it might be an issue. So you definitely want to make sure you speak and you have this done under the care of a dentist who specializes in sleep medicine. So not just anybody. So you just have to be careful of who you're working with. And so these devices are, of course, you can imagine, much more comfortable, right? You could travel with it. Literally comes in a case. You take it around the same way you would have your retainer. You wear it every night. You may need to reset your, there's sometimes a bite block that you bite into to just make sure you reset your bite when you wake up in the morning. Very effective for mild and moderate sleep apnea. Very effective. And the literature and the research is pretty strong about that. If you have severe sleep apnea, I would not say that would be my first option. I would still go with CPAP. But the beautiful thing is, if you have mild or moderate sleep apnea, you do not like CPAP, you can definitely try an oral appliance. What's the third? Number three, I will call our maxillary or palatal expansion treatments. And usually we do this in collaboration with our orthodontists. We work with a whole team of orthodontists. And these are just devices that help to create more room in your airway by not narrowing, but lowering, sort of that your palate. So some people have what we call a high palatal vault, meaning that if you look up at their hard palate, it's kind of up like this. And if you think about the fact that the nose, right, is the roof of the mouth. So if that palate is high, maybe you had someone who had thumb sucking when they were younger, or just the way their face is formed, it's going to make it hard to breathe through their nose. So they might have apnea. So what these expanders do is they lower and sort of create more room or widen that space so it's not as narrow. And when you have that widened space, the airway is wider. You're able to breathe better. I love this mode of treatment because it is literally dealing with the root cause. Of course, it's not surgery. It is, some of them is like hardwired, hard screws that are screwed to the top of your mouth. This is something you need to work with the orthodontist. Over time, they kind of expand it and you get that space reestablished. There are different ways by which those palatal expanders work. Some might be what we call rapid palatal expansion. Some are slower, especially in adults. You're not cranking open sort of the palate. The palate has sutures, so you kind of open it gradually. And so you have new bone forming. It's pretty remarkable the kind of results that we get with this. So this is definitely another option. Again, worked very closely with orthodontists. Usually the treatment may take somewhere from like 6 months, sometimes up to a year. And after that, you do some other treatments and things like that. So if you have, again, severe sleep apnea or moderate sleep apnea, my recommendation is you're getting some kind of treatment as a bridge until you get full benefit from that intervention. So we've talked about CPAP, we've talked about all appliances, we've talked about rapid maxillary or palatal expansion, as well as the slow version. And then number 4 would be weight loss. So remember I said sometimes it's fat around the neck, it's fat in the tongue, it's crowding of that upper airway. When we have fat, either neck fat, abdominal fat, obesity, it increases the risk of obstructive sleep apnea. Why? Fat just takes up space, right? So in that situation, weight loss, and this has been shown by so many organizations, so many studies, weight loss will decrease the severity of your sleep disordered breathing. So I always recommend that my patients lose weight, right? And I would love to tell you, oh, if you lose 20 pounds, your sleep apnea will go away. We just know that even a few pounds will improve, your overall well-being and your sleep disordered breathing. Usually, if you start off with a certain weight and you've lost about 10 to 20% of your body weight, where we feel like your weight has plateaued, your weight loss, we might do a repeat sleep study and we might move you from severe to maybe moderate or mild. And then that just kind of opens up new treatment opportunities. Now, how do we lose weight? Of course, diet, right? Healthy diet, limiting junk food, working usually with an obesity specialist or nutritionist to make sure you're taking the right meals. Physical activity, so moderate, intense activities and things like that is very important. And now we have many weight loss medications. And so some of them are, the GLP-1 agonists. And in December of 2024, actually, a study was published that showed that Zepbound, which I happen to have a sample of that here, Zepbound or tirzepatide, is FDA approved for treatment of obstructive sleep apnea. I'm here to tell you any type of weight loss medication or any type of weight loss strategy will improve your sleep apnea. But Zepbound happens to be one that's been FDA approved. So what does that mean? It means you can literally get this medication for treatment of your obstructive sleep apnea, and some insurances cover it, which is great. So weight loss, whether it's through medication, whether it's through diet and exercise, will improve the severity of your sleep apnea. Again, it's a journey, right? You didn't put the weight on overnight. So that means that while you're on that journey, you're using something to help you. So you might need to be on CPAP, you might need to be on an oral appliance. The beauty of this is, especially with something like CPAP, if you're using it well, you are motivated because now your metabolism is better and you're more likely going to lose weight successfully. So again, I'm not here to preach that you should use CPAP, but I'm here to just let you know that that's definitely beneficial. And then number 5 is surgery. There are many surgical options available to treat obstructive sleep apnea. So whether it's the tonsils or adenoids, which is the surgery, we call it adenotonsillectomy, where you're taking out the tissues at the back of the throat. If I open my mouth, I don't think you'll see it. Or right at the back of your nose. So these tissues become really large, especially in children. And that tends to be actually one of the first line treatment for sleep apnea in children. You take it out, many times it's actually curative. In adults as well, some adults have big tonsils, big adenoids, so we tend to do that surgery as well. Your ear, nose, and throat doctor is usually the specialist for that. Other surgeries, there's one called uvulopalato-pharyngoplasty, or UPPP. Like, it's a whole lot of P's. Literally, they're shaving off all that soft palate, uvula, all the tissues at the back of your throat that's felt to be redundant and contributing to sleep apnea. Painful surgery, has some complications, but it's definitely an option. And then another is nasal surgery. So whether you have a nasal a septal deviation or nasal polyps, of course, if your nose is clogged up, it's going to be hard for you to breathe. So you might have apnea. So working with the ear, nose, and throat surgeon for that is also helpful. Another type of surgery is what we call the hypoglossal nerve stimulator. Okay, so what this is literally a surgery that is done to implant what looks like I would say almost like a pacemaker that helps to contract the muscles in the throat, right? So it contracts the muscles so things are not collapsing on themselves. So this is also a surgical option. There's certain criteria that needs to be met to get that surgery done. In some people it's effective, in some others it's not as effective, but absolutely an option. And then another surgery I will talk about is the jaw surgery. So there's so many, we call them some mandibular advancement surgeries. Sometimes it's moving your face a little bit, shifting it forward, your maxillary reconstruction. There's a whole host of surgeries. So usually you might need to work with a plastic surgeon or an oral surgeon in specific cases to figure out if that would be good for you. So that surgery seems to be a little invasive, but definitely can be curative and life-saving. And then the last but not the least I want to talk about is medication. So if you have, for instance, a lot of allergies, right? Seasonal allergies, allergic rhinitis, where your nose is clogged up, and all of that can contribute to sleep apnea. So if you have very, very bad allergies, sometimes optimizing using the right allergy treatment, sometimes we'll do sinus rinses. We might put you on a nasal spray. We may put you on antihistamine or other allergy medications. You might actually need to get allergy shots. So really treating those allergies can improve sleep apnea. Here's what I would say though. If you have more of the moderate to, severe sleep apnea, most times just treating the allergies may not necessarily solve it. But if you have more of a mild version of sleep apnea, I think it's very helpful. And then you know what? If you have congestion, nasal congestion from allergies, and you're trying to use CPAP, right? Imagine now you're trying to put this on your nose with a very stuffy nose. It's going to make it hard. So sometimes treating the allergies may actually help you tolerate other treatment options for sleep apnea. Oh my goodness. I just told you 6 different options for treating sleep apnea. We've talked about CPAP, oral appliance, palatal or maxillary expansion, weight loss, surgery, medications. Knowing what can happen if we do not treat sleep apnea, you do not have a choice not to get the treatment. There are options available. I do not want a heart attack happening, arrhythmias, hypertension, obesity, all of that. We can avoid those complications or at least slow down the progression, even if you've developed it. And so that's why I wanted to do this video, to shed light to, I have sleep apnea. So what now? I don't want you to roll over and act like it's not true. It is real. This is a disorder that is very dangerous. It does kill people through multiple mechanisms. Imagine a heart attack. Imagine having a stroke, all of those things, right? Imagine being so sleepy you get into a car accident. I don't want that to happen to you. But if you get on that treatment, imagine a situation where you wake up refreshed. Like I told you, one of my clients said, she said, this has changed my life. I used to live in a fog for years. Now I can see clearly. Now I'm better organized. Now I'm much more productive because I went ahead and treated my sleep apnea. So that can be your story, and you're just a step away from that. How on earth are you going to get to do that? Number one is to really just come to terms with, okay, I need help. Get diagnosed. Once you get diagnosed, make sure you find a sleep specialist that does listen to you and gives you and empowers you with the options. And that's really what we do at the Restful Sleep Place. Would be more than happy to serve you in this way. We walk our patients through this journey, like literally walk them through this journey, so they never feel alone. You're getting the best treatment. We would be more than happy to help you. If you're located in Pennsylvania, New Jersey, or California, come check us out. Visit us. Our phone number is 215-607-8297. Give us a call, and then we'll tell you more about the program. It's a very powerful way to help others. So I hope this has been helpful. Listen, this is one you probably want to come back to. This is one you want to share with a loved one. The prevalence of sleep apnea is obscenely high, and many people are not being treated. I do not want you to be one of them. So share this, tag a friend, forward it to someone who you know would benefit, and re-listen to it, because I know I packed a lot in it. And if you have any questions, feel free to reach out. Let me know in the comments. And until next time, I hope you rest well.